When you come across treatments that make claims to treat those with ASD, you need to review each carefully and ask some important questions. These are, how do you know it works? What is your claim based off? What process did you use to come to your conclusion? These are key to discovering the evidence and deciding if a treatment is science, pseudoscience, or anti-science. To help you decipher between the claims, compare using the next explained dimensions. The dimension, speculation versus demonstration, allows you to see if a treatment really has evidence. Speculation is the thoughts or feeling that a treatment works. Demonstration is actually shown and documented. You may think that this should be easy to see, but when someone has an impressive title, sometimes doctor, or seems well versed in what they are promoting, it can be deceiving. Subjective versus objective is another dimension. There are times that subjective reports are useful. However, subjective evidence is based on personal accounts. This takes into account human bias and perspective. And examples of how this can skew evidence is that one person's account of an event may look and be described completely different from another person's account. Objective evidence is observable and measurable. It can be repeated by anyone and they will get the same outcomes if the procedure is followed correctly. It minimizes human biases and uses multiple measures instead of a single perspective. Another dimension is indirect versus direct measures. Similar to subjective, indirect measures uses people's reports about their perceptions of what happened. It can also mean asking those around the person who was given the treatment. Direct measures uses objective observations to determine outcomes. Like objective, it is measuring observable results or descriptive observations. Like subjective observations, indirect measures can be important and be part of the whole picture. However, they should be supported by conclusive, proven evidence. Evidence can be shown through a non-comparative versus comparative support. This tells us how a therapy compares to no treatment and many other treatments. Anecdotal notes and testimonials do not offer the support needed to show a therapy is effective. Evidence should be shown under different conditions and then comparing those results. These comparisons rule out other explanations or variables while confirming others. Uncontrolled versus controlled research is the dimension that shows the overall picture of how the evidence was gained. Research should start with observation and description of an event in its natural environment. This provides information in which a hypothesis, kind of like a guess, is created. Whether research is uncontrolled versus controlled increases or decreases the validity of the experiment throughout the process. Uncontrolled research doesn't control the scientific process and allows confounding or outside variables to compromise the data, while controlled does not. Please know that if it sounds like a miracle or the claims are astounding, it probably is not true. Be aware of testimonials or sales pitches. Be sure to look for published studies and dissect the evidence using the dimensions described above. If it's new, back away and let time be the true test. Lastly, look for objective evaluations of all treatments that are used.